Good morning, everybody. Thank you so much for joining us today. I am very pleased to be joined by a very distinguished panel. We have Wisconsin Lieutenant Governor Mandela Barnes. We have Arizona State Representative Athena Salmon. We have Dr. Howard Foreman from Yale University. He's an expert in public health. And we have Dr. Angela Rasmussen from Columbia University, a very distinguished virologist. My name is Zach Petkanis. I am the director of the Coronavirus Protect Our Care War Room. Today, we're here to deliver a very clear message that Donald Trump must cancel his super spreader rallies. They are a danger to public health. Here's the situation. The virus is out of control. It is spreading at an alarming rate. We're back up to 70,000 new cases in a day, which is the first time that that's happened since July. The US continues to lead the world with nearly 220,000 deaths and more than 8.1 million cases. There are only 2 states in the country that are seeing coronavirus cases decline. There are 39 states that are seeing coronavirus hospitalizations rise. But instead of taking decisive action to fix the crisis, Donald Trump is making things worse. From day one, he's downplayed the danger. He's ignored the experts. He's rushed states and schools to reopen. And now he's holding super spreader rallies that are engaging in the exact behavior that experts tell us is what's making the crisis worse and spreading the virus. This last weekend, he held a mask-free super spreader rally in Wisconsin. This is a state with a positivity rate over 20%. There were thousands of people without masks that weren't social distancing. Today, he's holding 2 of these rallies in Arizona. This is a state with over an 8% positivity rate. Again, it's gonna be mask-free without social distancing. Later this week, he's going to hold rallies in Pennsylvania and North Carolina, again, states that are trending in the wrong direction and that have very high positivity rates. We've already seen the consequences of these rallies. There have been infections that have been traced back to Trump events throughout the country, including Minnesota, where we saw 24 people become infected. Earlier this month, there's a study which we'll send around in the follow-up from STAT, that did a study that showed that of 7 of 14 cities and townships where there were rallies that Donald Trump held, 7 of them had big spikes, including in Oshkosh, Wisconsin, and Weston, Wisconsin. So we're already seeing the consequences of these rallies. And it's not like Donald Trump doesn't know that these events are spreading the virus. Dr. Fauci has said that these kinds of events are, quote, asking for trouble, unquote. The bottom line is that he cares more about his reelection than the health and safety of the public. And so it's time for us to say enough. And that's why we're here today, to demand that Donald Trump cancel these upcoming super spreader rallies and start taking this virus seriously. And with that, I'd like to turn it over to Wisconsin Lieutenant Governor Mandela Barnes. Lieutenant Governor.
Thanks so much. Thank you for having me, and thank you for setting the stage. And what we see is the Trump administration is letting this happen, unfortunately, by doing nothing serious to combat the virus. And on the other hand, we have the Trump campaign that's absolutely making things worse. We see these super spreader rallies in some of the worst COVID hotspots in the country. Wisconsin, to name one specifically, as you just did. He had a rally in Janesville, where 1 in 138 people in Rock County are actively battling COVID-19. This is an area, much like in many other parts of the state, that are dealing with it, or that is currently dealing with the devastating impacts of COVID-19. We've seen medical experts who call for Donald Trump to cancel the rally, but of course, he doesn't listen to science, he doesn't listen to medical experts. We know that mask use was far from consistent, and Trump even said, I wish you had a Republican governor, because frankly, you got to open your state. You got to open it up. And Republicans have absolutely failed to lead in this crisis. They haven't passed a bill in over 180 days. They have ignored this crisis. They have been completely absent when people are losing their lives, people are losing their livelihoods, and the situation couldn't be worse. And their failure to act is going to cause even more devastation in our state. And even Trump's own White House coronavirus task force has warned that gatherings in Wisconsin without social distancing measures will lead to preventable deaths, and also told residents to avoid crowds in public and social gatherings in private. And not just Wisconsin, we need to be concerned about, because most states are currently trending in the wrong direction, with many being listed as having an uncontrolled spread, which I can tell you is not a good thing. Where Trump has recently held rallies here in Wisconsin, we have a 20.7% positivity rate, uncontrolled spread. In Nevada, 37.2% positivity rate, uncontrolled spread. In Florida, 11.9% positivity rate, uncontrolled spread. Iowa, 25.5% positivity rate, uncontrolled spread. In Michigan, which is probably the place that has had the least activity, it at 3.7% positivity rate is still trending poorly. This just goes to show you how bad the situation is all across our country. And where Trump is holding rallies this week, he'll be having one in Arizona with an 8.6% positivity rate, which is also trending poorly. In Pennsylvania, 9.2 positivity rate, trending poorly. North Carolina, 6.4% positivity rate, also trending poorly. Donald Trump is going to places where the spread is starting to either out of control already or going in that direction. And he is absolutely going to make things worse because he's not going there with a plan. And he's not going there practicing proper distancing or practicing the medical advice that has been given, that so many Americans are actually implementing in their own lives. Here in Wisconsin, we have a very high favorability rate for mask wearing. And we see high positivity rates that indicate uncontrolled community spread. A Trump rally in a location with a high positivity rate is right to become a hotspot. In places where the positivity rate may be lower, but trending upward, a super spreader event has the potential to be the catalyst in starting this domino effect that will send that location spiraling into outbreak. And ultimately, Donald Trump super spreader rallies will worsen outbreaks, as we know, as we should suspect. And this is a daily proposition for people in these communities. Trump has a long history of not just endangering himself, but his staff and his own supporters and whole communities with maskless, non-socially distant super spreader events. He's engaged in a long history of super spreader events since the start of this pandemic, holding dozens and dozens of official and campaign events, I should say, that ignore all the guidelines and all the mitigation efforts that so many public health officials have worked tirelessly to put in place. And his super spreader schedule has only increased since his own hospitalization, accompanied with bizarre, inaccurate claims that he's now fully immune to the virus because of his illness. Maskless events have proven to be super spreader hotspots, and it's widely acknowledged that the Amy Coney Barrett Rose Garden nomination event is directly linked to the White House outbreaks that infected Donald Trump, his top aides, and Republican senators, including one of our own here in Wisconsin. And those same individuals are bringing their carelessness and contempt for safety measures to the rest of the country at these rallies. Senator Ron Johnson had a test and did not get the results of his test before he went to an event, later finding out that he tested positive. He said he didn't care where it came from. He also said that it's not a death sentence. And there have been recent reports that have shown that almost all of the young people who have lost their lives to COVID-19 have been Black and brown. So it's not whether people are dying or not, it's whether people care about who's dying or not. And our own Republicans are following suit. And like I said, with the event that I just mentioned, and that this spread the virus to other Republican state lawmakers as well. And when he resumed his campaign schedule, including these rallies, Dr. Fauci said his decision was asking for trouble. And we can see the massive long-term effects on communities as so many small businesses are struggling because the virus is not under control. Businesses are shutting their doors. Donald Trump isn't just bad for communities, bad for public health. Donald Trump is bad for business. A great example of a catastrophic super spreader event is the Sturgis motorcycle rally as well. I think we should mention that. Increasingly, experts are pointing to Sturgis as a leading contributor to the severe outbreaks across the northern Midwest. Hundreds of cases have been linked directly back to Sturgis, but it's likely that the full extent may never be known because there's been no effort to contact trace the outbreaks originating there. And it's not just attendees who get sick. The impact of these events, as I said, rip through communities, ultimately have a deadly impact on individuals who had no connection to the event at all. People who have done everything right in the middle of this pandemic still find themselves in harm's way because of the way that the president has chosen to respond to this crisis and still go about these things in a very reckless way. And that's exhibited in the case of a Maine wedding, resulting in a number of deaths. And as outbreaks across the country get worse, the potential for Trump rallies to become deadly events increase, and it becomes a compounding problem. And as we've seen from the past rallies, there will be no attempt to implement mitigation efforts. I mean, none of these events will be socially distanced. They won't include widespread mask wearing, and they won't even encourage mask wearing. Like we see, the president mocks people like me for wearing a mask because we want to do the safe thing, because we want to make sure that we keep people alive in our communities. And in a number of these states, Trump has already visited over the course of the last several weeks. He held another Pennsylvania rally on the 13th of this month, and the danger increases when the campaign returns to states 1 to 2 weeks after already holding a super spreader event, when the effects are of the first are likely just taking hold. And we need more responsibility out of the White House, someone who is actually going to be concerned with the health and safety of the people of this country.
Thank you so much, Lieutenant Governor Barnes. Now I'd like to introduce Representative Salmon from Arizona, where Donald Trump is holding 2 super spreader rallies today.
Thank you. Thank you for the introduction. Thanks to everyone who's joining us to unfortunately highlight the irresponsibility in continuation by the President of the United States to ignore the advice of public health experts, to ignore the advice and recommendations of scientists, and ultimately continue to put the American public, including Arizonans, at risk of not only contracting the coronavirus, but potentially perishing as a result. Specifically to Arizona, we've had a rough week and a half. One of my own colleagues, a state representative that is also a friend, almost lost his life last week battling the coronavirus, had followed all the mandates, had followed all the guidance. But when you have these super spreader events, when you have people who are not taking this seriously, you even put people who are being of the utmost cautious, you are putting everyone in your community at risk, not just yourself. And that's the thing about these super spreader rallies that the president is holding. I was looking at one of the rallies, the first one that's happening in the morning is going to be in Prescott, Arizona. And I was looking at photos of the event, and it's just jarring. The chairs are on top of each other. I know both in the town of Prescott and in the county, there's no mask mandate because unfortunately our Governor Doug Ducey, has not found the political will or the heart to do a statewide mask mandate and save lives. And, in Arizona, we have already an 8.6 positivity rate. We are trending poorly. This is before Donald Trump coming to do these super spreader rallies in Prescott and in Tucson today. And unfortunately, we are one of the states that, for several months, we had the highest cases per capita in the country for June and July. And much of it has to do with this administration. You lead by example. And unfortunately, this administration has been leading by a very poor, a very dangerous, and ultimately a deadly example. And so we are nearing now in Arizona, we are nearing 6,000 deaths. Those are 6,000 Arizonans who lost their lives too soon, because this president, this administration has failed the American public to protect us and to ensure that people are healthy and safe. And, it's just incredibly frustrating. It's utterly irresponsible to continue to hold these in-person rallies, especially since, the president and several high-ranking Republican officials had a super spreader event with the swearing in, not the swearing in, but with the event regarding the nomination of Amy Coney Barrett, and how we saw that ripple effect in Washington, D.C. And, so it's just, we're calling on the president to cancel these events. It is not worth an election. It is not worth the political points that he thinks he's going to make by putting these communities, including Arizonans, where we don't have a statewide mask mandate, where he's doing a rally in an area where the local officials haven't stepped up and protected their residents, their people. And we're calling on him to cancel it and keep these lives safe. One other thing I'll note about Prescott is that community, that town, it's so beautiful. That community, it has amazing pines. It's a wonderful place, and it also is a community that highly has a lot of retirees who retire there because of its beauty and because of its lighter climate. So the other thing I'm concerned about is even if some of these retirees, even if some of these seniors don't attend the Trump rally, the reality is they're going to be living in the same community to the people who did, who are not socially distanced, who are not wearing masks, who are disregarding the public health advice and guidelines, and they're going to be putting their fellow neighbors at risk, and it's just wrong. And so I'm joining so many people, so many elected officials who have been acting responsibly, who have been leading by example, and urging the president to follow suit and to cancel these super spreader events.
Thank you so much, Representative Salmon. And now Dr. Howard Foreman of Yale.
Thanks very much. I just want to, echo what Lieutenant Governor Barnes and Representative Salmon have said. We are witnessing an avoidable tragedy in our nation. We are among large nations in the world. We have the worst death rate. The only places that are comparable to us are basically Brazil and Mexico, countries that we otherwise do not see ourselves competing with for greatness. And we certainly have far greater resources available to us, and yet we are basically competing with them for worst in class in terms of performance. These super spreader events are bad on two different levels. One is that we are harming people that are attending them, and many of these people are doing so by their own free will, but unconsciously or consciously, they are doing so in order to prove that the president must be right, and walking away infected in many cases and spreading it into their communities. And the second reason why this is so horrible is that we count on our president to model the best behavior. And even in more traditional times, we would count on just good behavior. But in this situation, the president has a responsibility and ability to lead by example, and he is choosing not to. It is why there are at least 150,000 more people dead in the United States compared to if we were Germany or many other nations that have handled this much, much better than we have. There are literally tens of thousands of people who have lost their lives for no good reason other than the fact that they were modeling bad behavior. We need leadership that will show us how to get out of this pandemic, how to restart our economy, how to get back on a stable footing and be a leader in the world rather than a laggard in the world where people are dying unnecessarily. And I'll stop there and be happy to take questions later.
Thank you, Dr. Foreman. Dr. Rasmussen.
Thank you so much. I'd like to echo everything my fellow panelists said, and I'd just like to add that these rallies are based on a faulty premise. They are based on the idea that because President Trump has said so, that these are not dangerous activities. President Trump, especially after contracting the coronavirus himself, has dismissed the severity of disease, has said that basically it doesn't kill that many people, even though over 200,000 Americans are now dead from this virus. It is based on the idea that if you get immunity, or you may have some existing immunity, even if you haven't had the coronavirus, and therefore it's not a very serious problem that you shouldn't worry about, or that it actually may even be beneficial to get it so that you can enjoy the benefits of herd immunity, which is being talked about. These are all very, very serious misunderstandings of what herd immunity is, of what your actual risk is, and what the long-term risks are. Death is not the only outcome of COVID-19. People, including young people, are having permanent injuries because of their struggles with COVID-19. we don't know how long, if ever, many of these people will recover. So it is absolutely, it is just terrible and irresponsible and a dereliction of his duty for President Trump to be putting American citizens in a position where they could contract this coronavirus. And these rallies are very high risk events. And with that, I'll stop and answer any questions that people may have.
Thank you, Dr. Rasmussen. With that, so members of the media, if you'd like to ask a question, please just raise your hand in the, if you click on the participants key in the bottom, and then raise your hand and we'll open up the line. Brian, I'll let you unmute.
Thanks, Zach. First question coming from Peter Sullivan.
Hi, thanks. This is Peter Sullivan with the Hill newspaper.
Hey, Peter.
Hey, I wanted to ask Lieutenant Governor Barnes, and then if either of the health experts want to weigh in as well, but in Wisconsin, I mean, obviously a very bad outbreak. I wonder how much you attribute that to kind of the lawsuits and other resistance from the Republicans there. I mean, they've, unless I'm mistaken, right, they've sued over the mask mandate, they sued over the capacity limits in bars and other indoor areas, and the stay-at-home order back in May. So I mean, how much of an effect, on increasing cases and hospitalizations in the state, I mean, do you think those actions have?
Oh, I attribute so much to it because it goes back to that leadership argument. People should be able to trust their legislators to have their best interests, especially when it comes to public health and a pandemic, no less. But when they don't take it seriously, it encourages other people, so many of their supporters, to not take it seriously as well. And it's not like it takes a whole bunch of people not taking it seriously for it to spread. It only takes a handful of folks to do their own thing, to engage recklessly for us to get to this point. So my call is the same as it's always been, and it's for the Republican majority in the legislature to stop fighting us and fight the pandemic.
And I would just weigh in and say that, consistent messaging where it is nonpartisan is the best messaging you could have. The state of Wisconsin has been in a growing outbreak for months at this point. There is nothing that any single individual can do other than to have a consistent message across the board. That means that the governor, the president, the lieutenant governor, the state legislature should all be saying the same thing. We have an evidence base that suggests that masks work. We have an evidence base that says that you have to have social distancing and you have to have lower capacity within bars. We have an evidence base that shows people how to get testing when it's appropriate, to go through contact tracing and so on. If you have a large swath of the population that does not believe in this evidence-based approach, you're just going to have a worsening outbreak. It's beyond the control of any one person to lead in a situation where people are competing with messages.
Thank you.
I agree wholeheartedly with that. I'd just like to add that a lot of the focus in some of this mixed messaging has been on therapeutics and vaccines and things that are not really available to most people. What we do know is that the non-pharmaceutical interventions that Dr. Foreman was just talking about, they do work. And we need to make sure that people are consistently getting the message that it's not political. These are public health measures that have been tried and true and proven over time to reduce transmission, and we do need to be unified in that message.
Great. We're going to the next question from Christina Leffring.
Hey, Christina.
Hi, I'm Christina Leffring with Up North News. What would you say to Trump supporters who may try to construe this call as being political and not about public health?
Dr. Foreman?
I would just say that, from the beginning, I would say that, my colleague Jeremy Faust at the Brigham and I wrote a letter to Vice President Pence imploring him in early March, I think it was the first week in March, to enact vast, widespread testing, to put in place public health measures. I cannot speak to the motivations of the people on that task force or why they have failed. But these are nonpartisan, non-political messages, and they have been historically non-political. It is a disaster for our nation that this has become political. It is not political. It is about evidence. It is about facts. It is about science.
I completely agree with that as well. I think that the most unfortunate thing in this entire pandemic in the United States is the politicization of public health practice. Public health, while sometimes politics are involved because policy is involved, that's inherently political. The response to pandemics should not be. These measures that are being recommended to reduce transmission should not be. And it's just really unfortunate that we are having to discuss this in the context of a political rally and of a president who insists on continuing to wrap public health up in politics. The goal here, though, I think probably from all of the panelists, is to recommend ways to keep people safe, regardless of their political affiliation.
And I'll add too, like Governor DeWine in Ohio was one of the first ones out there with restrictions, making sure that he was taking it seriously, and he can never be confused for a Democrat. I know him. I met the guy. He's really not a nice guy, but he's not a Democrat by any means. Even look at Boris Johnson over across the pond, right? His whole change of heart, and now. What is that? Was the mayor of Manchester, if I'm not mistaken, who's challenging Boris Johnson now, and he is also not a person who could be confused for a liberal.
Brian?
Yes, we're going to our next question from Pian Huang.
Hi, this is Ping Huang from NPR. I wanted to ask how contact tracing is working for these rallies. Is there enough clear contact tracing to link cases to these rallies, or are we more making links between the testing rates in certain counties and the location of the rallies and the timing?
Dr. Aston?
I was going to say, does Dr. Foreman know the answer to this question? Because
Yeah,
I
would
don't.
say it's so contact tracing starts once you identify an infected individual, and then you work your way back and forward as well. It is almost impossible to imagine at these large rallies to be able to do effective contact tracing, because you'd actually have to have an attendee list. You'd actually have to have willing participants. One of the most frustrating things about these rallies is these are the people that are least likely to want to engage in the public health system to prevent further spread. We saw this even with the White House, the same thing with the Rose Garden ceremony. So that is also what is frustrating about this, is you're basically having an event that is against all the principles of public health, and therefore these are the people that will be least likely to want to engage in the system and do contact tracing.
Dr. Representative Salmon, did you unmute to say something, or?
And I can just speak on the ground. In Arizona, there hasn't been robust contact tracing that's occurred. There's been efforts, but especially when it comes to these kind of rallies and events, as Dr. Foreman was saying, it's nearly impossible to actually trace it out. Besides looking at that zip code data and seeing that spike just on that aggregate number. So even on the ground, like, that's another concern that we have about these rallies happening in Arizona and in these other states.
Great, and then it looks like we have one more question in the queue from Jesse Hellman.
Hey, Jesse.
Hey, thanks for doing this. I was hoping to hear from Dr. Rasmussen on where we are specifically right now in the pandemic. We're seeing cases increasing in most states. We're heading into the colder months. I know that we're not in a good position in terms of case numbers. Can you talk about that and how that kind of corresponds with the rallies? Does it worry you? I mean, I know that you would probably not want to see rallies at any point during the pandemic, but can you talk about specifically right now as we're about to head into the fall and winter?
Yeah, I can. So it's really hard to tie the increase in cases that we're starting to really see nationwide, but overwhelmingly right now in the Midwest, to the rallies alone. That said, as you pointed out, the colder months are coming. People are more likely to be inside gathering together. Rallies will not be able to be held outside for much longer. And even outside, people have talked about this as if just being outside is a magical thing that can eliminate the risk of transmission, and that's simply not true. When you have enough people together in close proximity, not wearing masks, potentially shouting and singing and being loud, emitting a lot of particles from their respiratory tracts in the same space, even if it's outdoors, that's still a significant transmission risk. So you move all of that inside, and it's not looking good. Trump has advocated for really unfettered reopening. And those calls are becoming stronger and stronger in concert with this idea that it might actually be helpful for most people to get infected if they're low risk, because that will allow us to reach herd immunity more quickly, which is completely untrue. So I think that these rallies just encourage behavior that puts people at higher risk, even when they're not at the rally anymore. And I think that is only going to help amplify the surge in cases that we're now seeing, and that we probably will continue to see as the weather gets colder and people are spending more time indoors with each other.
Thank you, Doctor. So those are the final questions. I know we wanted to keep this as close to noon as possible. If any of the other panelists have any final thoughts they didn't get out, otherwise we can wrap it up. All right, so I want to thank everybody. Wisconsin Lieutenant Governor Mandela Barnes, Arizona State Representative Athena Salmon, Dr. Howard Foreman from Yale University, who had to pop off a couple of minutes ago, and Dr. Angela Rasmussen from Columbia University, distinguished virologist. I want to thank everybody for joining today for this call with a clear message that Donald Trump's super spreader rallies are a danger to public health, and he must cancel them immediately. Thank you all very much for joining.
Thanks.
Thank you.
Thanks so much for having me.